Hi, and good morning. Welcome to the AMA Telehealth Immersion Program, part of the AMA Steps Forward Innovation Academy. My name is Laura Fritchie, Project Administrator for the Digital Strategy Team at the AMA. Today we'll be hearing the results of the AMA Digital Health Research that was released last month. Progress here. Here's a disclaimer. As an agenda, I'll start with introductions. Then Meg Barron will introduce the AMA Digital Health Research, and we have Kevin Gajar who will present on the findings of the research. We'll do a Q&A, and then I'll do a wrap-up. As a reminder, if this is your first session, we do have a virtual discussion thread on the AMA Physician Innovation Network. So if you have questions during this discussion, following the discussion, you're welcome to go here. You can scan the QR code and ask your questions. And Kevin and Meg, I will direct any questions from that discussion chat to them directly. Our first presenter is Meg Barron, Vice President for Digital Health Innovations at the AMA. Meg is passionate about driving change by collaborating with physicians, technology leaders, and solution innovators to improve healthcare. She has served in product development and business development leadership roles at the AMA, and most recently is responsible for driving the roadmap of initiatives that support the AMA's digital health and medicine strategy. In addition, she has led partnerships and innovation-related initiatives, such as the inaugural AMA Healthier Nation Innovation Challenge, the establishment of the AMA Interaction Studio at Matter, the AMA Physician Innovation Network, the AMA Digital Health and Telehealth Implementation Playbook Series, the Telehealth Initiative, and the AMA Telehealth Immersion Program. She participates on the advisory board for Matter, Mass Challenge, Health Tech, MedTech Color, FDA Collaborative Community, Together.Health, and as a TED-Med research scholar. Meg has spoken at national conferences such as Health 2.0, Connected Health, HLTH, American Telemedicine Association National Conference, HIMSS, National Health IT Summit, and contributes as speaking faculty for Columbia Business School's Digital Health Program curriculum. She has articles published in Health Affairs, Harvard Business Review, and Nature Digital Medicine. Meg, I'll pass it to you.
Well, thank you, Laura, and thank you everyone for joining us today. We're really looking forward to providing a summary of AMA's latest digital health benchmark research. Next slide. First, for some background, AMA's digital health strategy is focused on helping to ensure technology can help to be an asset and not one more thing or an additional burden for patients and physicians. And with physician burnout at an all-time high, never before has there been a larger need for technology to help play a role. To help accomplish this goal, we've focused our strategy and our work really on research to help identify gaps and areas where we can provide pragmatic, or as pragmatic as possible, resources and programs, such as the number of the resources listed here and our telehealth immersion program that you're participating in today. So thanks again for being here. Next slide. Our strategy began by first doing benchmark digital health research in 2016 to look at physicians' usage, enthusiasm, and key requirements for adoption, really to help to get a baseline for the industry for digital needs and opportunities in digital health. We then repeated the survey in 2019 and released results just about a month before COVID, which was really interesting to already see the change from 2016 in terms of usage and adoption to 2019, which again, this was still pre-pandemic. So today's summary will focus on our latest 2022 survey results and trends that we've been seeing from the past two versions of this study. Next slide. Regarding our methodology, we once again went to a national sample of 1,300 physicians across different states, specialties, genders, and age ranges, and we leveraged the same quantitative format for this version. Next slide. The survey questions were focused again on physicians' current usage of the 7 digital health solution categories that we asked about in the 2 previous versions, including overall motivators for use of digital health technologies and key requirements for use. In addition, for those solutions that physicians are using, we asked deeper dive questions where participants were asked to force rank their motivators and requirements for use that Kevin will get into more detail on. Next slide. We also use the same definitions and 7 categories for digital health solutions in order to again see a trend line in any shifts in usage from the previous 2 iterations. Next slide, please. So I'll kick off just with a top line of our key findings, and then Kevin, my colleague, will provide more detail on all, and again, a little bit more of a deeper dive into some of the results in comparison to our 2019 and 2016 results. But overall, at the highest level, number one, there's been an increase in the number of physicians that see a definite advantage in digital tools. And again, back to with physician burnout at an all-time high, never before has there really been a greater need to be able to leverage digital solutions and technologies to help really meet the needs of helping to ensure that the patient-physician relationship is as strong as it possibly can be. Number two is that adoption of all 7 digital tools and categories has grown significantly among all physicians, and this is regardless of gender, specialty, or age. And again, we'll get into a bit more detail on some of that in Kevin's portion of the presentation. Number 3, adoption of remote care tools such as telehealth and remote patient monitoring has seen the most movement. And no surprise on this, right? With the pandemic, this has been an absolute necessity to ensure that care could be delivered between physicians, patients, and the care team. Number 4 is really growth and enthusiasm has largely been concentrated in telehealth. And I think that this is interesting. And if you would take the EHR as an analog for this, of course, there's been a lot of frustrations for the EHR amongst the physician community, mostly because there hasn't been as much physician involvement leading into the adoption and implementation of those. So with telehealth as an analog to that, it's really interesting to see that the enthusiasm is as high as it is for telehealth, especially given that most physicians, or more than, I would say, 50 to 60% of physicians use telehealth for the first time during the pandemic. So again, we'll get into a little bit more of the details on that during this presentation. And then this year, we did ask about emerging technologies such as AI and digital therapeutics, and found that awareness is quite high for these categories, but current usage is quite low at this point. That said, there is enthusiasm or an anticipation to use these technologies in the coming year or few years. And right now, though, there's about 1 in 5 physicians that are currently using some form of AI, more so for practice efficiencies, but about 2 in 5 plan to adopt in the next year. So I think, again, something interesting to consider, especially with kind of the opportunity on the table to leverage technology to help meet current needs. Next slide. One key point I do want to call out is in terms of physicians' requirements for adoption of digital technologies, these have remained the same and really fall into 4 key categories that we use as foundational to our overall strategy. And these 4 key areas are really around prove to me it works and that these solutions have an evidence base to them and are trusted. Prove to me that there is proper payment pathways for if I use this or prescribe this to my patients, that I will get properly paid or reimbursed for this. Prove to me that there's liability coverage, and this is both for medical malpractice, but also for data privacy and for data security. And we continue to see that need and requirement increase in terms of necessity in terms of use. And then lastly, and often what's most difficult at times, is just the change management of integrating and adopting new technologies into your existing workflows, into your existing EHRs, and helping to really coordinate that with your care team. So again, we're looking forward to getting into more detail on all, and with that, I'm going to turn it over to my colleague, Kevin. So thank you for being here.
Next, we'll have Kevin Gajar. Kevin is a market research analyst for the Strategic Insights team at the AMA, focusing on quantitative research methods. He graduated with a Master's of Science degree in economics from Florida Atlantic University in 2017, and he'll be going into more of the specific research findings that Meg mentioned.
Thanks, Laura. So yeah, I'll go ahead and jump right into the findings. We started out the survey with a sort of general attitude question. Specifically, how much of an advantage do you find that digital health solutions give your ability to care for your patients, ranging from a definite advantage to a definite disadvantage? And here we can see that the percentage of people who said that it's a definite advantage has grown since 2019 and grown even more since 2016. So from 2019 to 2022, on the left here, looking at the total number of physicians, you can see about an 8-point jump from wave to wave, while the number of disadvantage has decreased from 11 to 6%. over the same time period. And when we compare PCPs and specialists, we see a similar story. And for PCPs, we see a 7-point increase from 2019 to 2022, an increase in definite advantage. Similar, we see an increase with definite advantage with specialists from 33% to 40%. Now, overall, specialists are a little bit lower on seeing the definite advantage compared to PCPs, but they're growing at the same rate. And when we compare by physician age, we see another similar story where regardless of age, we see a pretty high jump in the number of people who are seeing digital health solutions as a definite advantage. But even more so with the 51 plus age group, we see an 11-point jump from 2019 to 2022 here. Next is the big question. Which of these 7 digital health solutions are you currently incorporating in your practice? And the big story here is the percentage of physicians who have used televisits or virtual visits. It has nearly tripled since 2019, going from 28% all the way to 80% this year. A pretty significant jump, of course, spurred on by the pandemic from 2020. But that's not the whole story. We see every other solution as well has seen pretty big jumps ranging from 14 points to 10 points, regardless of the solution. They all have seen significant jumps during the past 3 years. Like Meg mentioned, the biggest jumps aside from televisits are the remote monitoring solutions. We see for remote monitoring for efficiency, a 14-point jump year over year, and a 12-point jump for remote monitoring for improved care from 2019. Next here, we're looking at the average number of digital tools physicians use. So out of the total of 7, on average, how many are they using? And here we can see when we look at the total number of respondents, about 3.8 is the number of on average tools people are using, which is a huge jump from 2019 where we see it was just at 2.4. So about a tool and a half, an increase from 2019. And one is obviously the televisits. That's across the board, people are adopting. And then it could be a mix of variety of other solutions depending on the practice needs. When we compare by physician age, we see pretty similar across the board. They are about at 3.8 tools used. And then we see a big jump when we look at the older physicians, again, 51 to 65 age group, from going from 2.3 to 3.8. And again, here with gender, we see a similar story. Both have made incredible jumps from 2019 to 2022, about 1.5 tools used. When we go to tenure, we're seeing a little bit of a difference spark up here. The higher tenured physicians are just a hair under the lower tenured physicians when we look at average number of tools, 3.7 compared to 3.9 and 3.8. In tech enthusiasm, that is where we see the big difference. Those who are more skeptical of new technologies are less likely to adopt new digital tools on average, which of course makes sense, but we want to sort of progress those views and try to get them to adopt more and more technologies. Some other breakdowns that we can look at by ownership. We see those who are full owners of their practice are a little bit less likely to have a number of digital tools used compared to those who are just employees or part owners in their practice. And when we look by practice size, we see the smaller practice sizes are averaging a lower amount of digital tools used compared to the bigger practice sizes, going from about 3.4, 3.7 compared to 4 number of tools used. And a similar story when we look at practice setting. The solo practices and the single specialty practices are on average using less tools than the multi-specialties, the hospitals, and the medical schools. When we look at practice type as well, we see that specialists are lagging a little bit behind the PCPs in terms of the number of tools used. Next, we asked about their enthusiasm about these solutions. And here's a little bit of a different story. We do see with televisits that enthusiasm has increased significantly since 2019, jumping about 15 points. But for the remainder of the solutions, it's largely stagnant year over year. We see minor dips or minor raises, but overall enthusiasm for these solutions has not changed significantly. So when we look at those that are enthusiastic about these solutions, we also had a follow-up, and we just looked at of those who are enthusiastic, are you actually using those tools? And we do see a much higher rate of usage when we look at just those that are enthusiastic about the tools, which makes sense. They're more likely to adopt it. So we see from 80% of the total, we now have 94% of those who are enthusiastic are using televisits in their practice today. And similarly, we see a higher number of those that are using consumer access to clinical data, and then the tools across the board, we see a higher number of usage. So in this next section, we're going to look at motivators and requirements. So we put a list in front of the respondents, a list of motivators, things that will push them to adopt a new solution. And then we also had another list of requirements that are base needs that the solution needs to have in order for you to adopt them into your practice. And we asked them on a scale of 1 to 5, how important are these items for adopting a new solution in your practice? And then after that, we did a sort of small driver analysis to look at where are the big jumps in importance from last year, from last wave to this wave. So we'll go ahead and start with the motivators. So here we're looking at the top motivators are, of course, improving your clinical outcomes, improving work efficiency, and making sure that your patient privacy is protected. Now, when we look at the ones with the asterisks, those are new to this wave in 2022, and we see these three have immediately jumped to the top. Improving clinical outcomes, patient privacy, and care coordination immediately jump to the top in terms of motivators for adopting new solutions. While items like improving work efficiency and diagnostic ability have stayed at the top from 2019 and have even increased in importance. We look at work efficiency, it was 82% thought it was somewhat or very important, versus today, when we look at 2022, 88% think it's very or somewhat important. Similarly with diagnostic ability, 79% in 2022 versus 83% today. But another interesting point here is when we look at helps reduce stress and burnout, we see a pretty major jump, the biggest jump we've seen so far in importance from 2019 at the bottom here at 69% in 2019 compared to 76% today. On the back half of the motivators list, we see some other items that have jumped in importance. Allows me to provide care with my patients remotely. We see a 7-point jump from 2019 to today, as well as improving resource allocation for your staff, having a 3-point jump from going 69% to 72%. As well as provides a new stream of revenue. In the middle here, we see at 2019, it was at 54%, jumping 5 points to 59% in 2022. So then we have the driver analysis that we conducted for the motivators. So a little bit of background about this chart here. On the horizontal axis, we're looking at the importance in the top two boxes, similarly to just what we just looked at, the number of people who said it was very or somewhat important. And then on the vertical axis here, we asked them to rank all of these items, and so in terms of importance, and then we're calculating the percentage that ranked 1, 2, or 3 in importance, the top 3. So the big item to note here is that these two motivators are the big jumps from 2019 to 2022. Allows me to provide care remotely to my patients, and then helps reduce stress and burnout. Here we see massive jumps relative to the other motivators in terms of overall importance. The next list is the list of requirements. These are absolute base needs that need to be covered for the physician to adopt the new solution. So the big ones are still the big ones. Covered by malpractice insurance, well integrated with their EHR, and data privacy as served by their practice or hospital. These have been big for the past few years, and they continue to be big now. They're absolute needs for the physician. Some other big ones that have made a jump: reimbursed for time spent using. We see about a 6-point jump from 2019 to 2022, as well as supported by their EHR vendor at the bottom here, a pretty big jump, a 3-point jump from 2019 to 2022. On the back half of the requirements, we see that there has been some change here, but not a huge amount. We see that the shift for a need to be intuitive or requiring no special training here, the second one, has jumped from 74% in 2019 to 78% in 2022. Pretty significant jump there. And then when we look at the drivers for the requirements, we see here there have been some pretty big jumps from 2019 to 2022. The need for it to be intuitive or require no special training has had a massive jump in importance. And then the proven to be as good or superior to traditional care also had a massive increase in importance. And the top right quadrant is what we're calling our key requirements. They're absolute needs for a physician to have in order to adopt a new solution to their practice. And then we rounded out this section by asking, how involved would you like to be in the adoption of new solutions to your practice? Would you like to be responsible, consulted, or just informed? And we look at the left side here. What's interesting is that it's actually retracting in terms of the number of physicians who want to be responsible, going from 42% to 33%. So less physicians want to be responsible, and instead they would just like to be either more consulted or just informed about the new solutions to the practice. And we see that's a similar story when we look at PCPs and we look at specialists. We see the same story. Number of physicians that want to be responsible has lessened, versus the number of physicians that want to be consulted in the decisions has increased year over year. When we look at and we break it down by those who are owners or part owners or employees, we see a somewhat similar story. So for sole owners, they still want to be responsible more than not, but even then, the percentage is still decreasing when we look at sole owners from 72% to 63%. And we look at part owners, we see from 48% to 36%. And when we look at employees, it goes from 32% to 23% want to be solely responsible for the decision. So physicians in general are looking to be less responsible for these decisions of adopting new digital health solutions, and more want to be just consulted or informed on these decisions. In the final section, we had a couple of new questions about emerging technologies. The first being, when would you expect to start incorporating these new advanced technologies into your practice? So these new advanced technologies are augmented intelligence for practice efficiencies, augmented intelligence for clinical applications, biometrics, precision medicine, digital therapeutics, and blockchain or other data solutions. So we see the biggest number of usage, this purple bar here, is for augmented intelligence. Those two have been are the highest number of usage out of these products, followed by biometrics and precision medicine. But the interesting thing we see here is for digital therapeutics, we see a high percentage of physicians that are looking to expand this in the next 1 to 2 years, roughly 40% within the next year, and then beyond 1 year will be 42%. While we see blockchain has the lowest usage, and mostly about 1 in 5 said that they will likely never adopt these data solutions to their practice. Going back to augmented intelligence, we do see about just under 1 in 5 have currently adopted these solutions. We also see a high number that are looking to adopt in the next year or so. Next, we asked, what are the areas of key concern that technology can help the most? The one area that physicians said was supporting chronic disease patients through regular monitoring. The next highest area was supporting preventative care. About 3 in 5 so that these two areas would help the most, could be helped the most by digital health solutions. Followed by address and automate administrative burdens, and then augmenting physician capacity by supporting care for less acute patients. And then finally, create access in underserved areas. We can jump to the Q&A.
Thank you, Kevin. I think my Wi-Fi is working again, so sorry about that. If you have any questions, you're welcome to drop them in the Q&A for Meg or for Kevin. Feel free to take a second to do that. We have a couple in already kind of related to telehealth. We have converted 90% to telehealth. How can we continue practicing only as telehealth service to patients? I'll also just reference our last program we did as part of Telehealth Awareness Week, and we did have kind of an advocacy update around telehealth. So I welcome you to go to past events, and you can see the recording from that event as well. But any thoughts on that, Meg or Kevin?
Yeah, I'm happy to jump in. I think, the secret sauce that everyone's now attempting to wrestle with is how do you best blend together in-person care and the need for in-person care, right, based on the use case with virtual and the ability to continue having the convenience and access that telehealth can provide. We've been doing a number of listening sessions with different specialty societies to further determine how they are approaching this, again, because I think a lot of it has to do with the use case and what's kind of best practices that are emerging there. The other is just continuing to make the case for longer term, really strategic investment in what your digitally enabled care model or kind of pathway will look like. And we recognize at times that can be difficult to help to make that case. And a few things related there, and this was at a high level portrayed on our just key initiative slide. But we have a whole series called our Digital Health Implementation Playbook series. And one of the main books for that is specifically on telehealth. And this is broken out into different chapters that really range from what are the goals that you have for integrating this new technology or category into your practice, to how do you select the right vendor, to how do you make sure that you're meeting the objectives that you set and quantifying what that looks like. A section in that, though, is how do you make the case, right? How do you make the case for additional investment in this area? And that was something we were continually hearing from practices across the country. And we ended up actually developing something called AMA's Return on Health Virtual Care Value Framework. And the intent for this is to really help to provide a snapshot view and a framework that you as your own practice or health system can put in what your practice's environmental variables are and really what your objectives are. So are you fee for service or are you in a value-based environment? What is your patient population? What are your objectives? And then look at what and how value is being created via outcomes. So above and beyond just short-term ROI, which at times can sometimes be difficult to quantify, how is value being created or outcomes being generated for patient access or improved patient access? How is it being created for clinical outcomes? Things like no-show rates, where we've definitely seen improvements at times with telehealth. Things like patient and physician satisfaction, just overall, how has that experience been improved? And then, of course, for health equity as well. And, at times that can go hand in hand with patient access, but really meeting people where they are and providing additional options based on, again, their own personal variables. So we'd invite everyone to take a look at that. And we've heard from, again, practices of all sizes that that's been a really helpful tool to additionally make the case for the investment that's needed for a longer term, just virtual care strategy.
We have another question. Is there any evidence that digital technology reduces provider total working hours, clinic and admin hours per week?
Great question. I'd say that we've largely seen this vary depending on the specialty, depending on the workflow, depending on the use case for all. But I'd say anecdotally, this is where, again, we would invite everyone to check out a number of our past sessions as part of the telehealth immersion program. where practices have shared, both from that return on health value framework where they're seeing efficiencies gain, but also just some best practices in terms of how they are arranging their workflow, how they're arranging their care team to be able to drive, again, some efficiencies and improvements just in their overall workflows and experiences.
Another question, using technology to reduce burnout seems to be a theme in some of the findings. Do you have any examples of how these tools can be best used to help physicians reduce burnout?
Yeah, I think, again, there's a lot of examples from the practices that we've had an opportunity to work with, both from our telehealth initiative as well as from best practices we've collected from our telehealth immersion program. It will definitely vary dependent on what the specialty and use case is. But I think I'll take it from a patient lens that at times we've heard time and time again, just that this can help to provide autonomy in scheduling for sure, and convenience in terms of scheduling for sure. And we've definitely seen where no-show rates have been lowered as a result of this. So efficiencies can be had from that as well. But I will say, the kind of convenience and access pieces of that, or people not having to go drive to their appointment, park, have all the logistics that come along with that, take off work, play into this. And then from an efficiency standpoint, from the provider physician end, even my own doctor, I've seen them now do scheduling of 2 days that they're doing virtual only or telehealth visits, and the other 3 days like in the office. And I think, that can definitely help to gain efficiency if you get some rigor or formality to that, so that you kind of know, well, I'm definitely just going to kind of have my brain focused on all of my telehealth visits and scheduling this day. And then the others, I'm going to plan to be in the office for the, again, use cases and patients that I need to see in those scenarios. So those are just a few examples. We'd welcome also to continually hear from you and the audience on where and how you're seeing specifics around that, because we're looking to aggregate that back behind the scenes and also share and amplify those stories through things like this telehealth immersion program. So great question.
We have a question if the PowerPoint will be shared. So this deck actually is published if you go to and you search Digital Health Research AMA for 2022. All these slides are available on a report you can download. One more question. So do you expect kind of this optimism to keep growing out of the pandemic for digital use, or do you think this will kind of plateau, looking kind of predictively at, the next round of research that'll happen 3 years from now?
Great question. I think, if we have a crystal ball, I would say that what we do know, and we saw this as part of just the enthusiasm, let's take telehealth, for instance, that the enthusiasm's there. I think the devil's in the details, again, in terms of helping to ensure that both in-person care and virtual care strategies are in lockstep. Because what we don't want is this to cause additional fragmentation of care. And with so many new entrants, to the industry, there is risk at that at times. If these things aren't well coordinated, well integrated, that can result in overload of data that isn't actionable and additional alert fatigue. And also, there's definitely cautions to be had. That said, I think the interest to adopt, we've already seen that. The enthusiasm is there. Now it's really that, again, additional investment in helping to make the case for longer term strategies. And I think a need more than ever to share best practices of how do we really get to optimize virtual care with in-person care, so we do start to see those additional efficiencies.
Any other questions? And also I mentioned that the research is available, but also if you go to the related content widget, there's an option to download this PowerPoint from the console directly. I'll give it one more minute. If you have any other questions, feel free to type them in the chat. I don't think we have any more. Thank you so much, Meg and Kevin. I'll do a couple closing remarks here. Our next session will be December 1st, and it's another clinical case study presentation, and this will be telehealth for physical medicine and rehabilitation. And as I mentioned, if you have questions that you didn't get a chance to answer, they come to you after you leave. If you go to the Physician Innovation Network, you can follow this QR code. We have a live discussion thread, and I can make sure that Meg and Kevin see your questions. And just as a reminder for those that are, maybe this is your first time joining us for the Telehealth Immersion Program, this is a self-guided curriculum. If you go to the website, there's no formal program or sign up. You're welcome to register for events that are upcoming, and we have all of our past events recorded. And if you have any other questions about the program, you're welcome to email me directly at laura.fritchie@ama-assn.org. And thank you, everyone.